and at WisconsinEye.org.
Good afternoon, and thank you for joining us today. This media briefing is taking place at the Wisconsin Department of Military Affairs, where staff from multiple state agencies have been working out of the State Emergency Operations Center since mid-March on the ongoing response to COVID-19. Today's briefing is being carried live on YouTube. Joining us today are Major General Paul Knapp, Wisconsin's Adjutant General, and Department of Health Services Deputy Secretary Julie Willems Van Dijk. They will be providing an update on the important work that continues to take place here at the SEOC. After some brief opening remarks, we will open the line to questions from reporters in the order in which their RSVP was received. We will go first to Major General Paul Knapp, Wisconsin's Adjutant General.
Good afternoon, ladies and gentlemen. I'm Major General Paul Knapp, and I'm Wisconsin's Adjutant General. In that role, I command the 10,000 citizens, soldiers, and airmen of the Wisconsin National Guard, and I'm responsible for overseeing Wisconsin Emergency Management and our State Emergency Operations Center. I'm honored to join you this afternoon to give you an update on the efforts in response to COVID-19. Your Wisconsin National Guard continues to remain very busy. Currently, we have more than 1,000 of our citizens, soldiers, and airmen serving in direct support of the state's response to COVID-19. We have a number of ongoing missions across the state. Perhaps most notably, recently mobilized an additional 225 citizens, soldiers, and airmen as part of the state's effort to increase COVID-19 testing capacity. We originally had 3 specimen collection teams capable of establishing mobile testing sites. Those teams established a specimen collection site at a senior living facility in Sheboygan County on April 5th, and another at the Milwaukee County House of Corrections on April 18th, where they began the process of testing nearly 950 staff and inmates. We deployed 2 more mobile testing sites this week in the city of Milwaukee and are bringing 8 additional teams online in the coming days to be available to establish additional testing sites at locations still to be determined across the state. Additionally, we have set up a call center comprised of 30 Guard members to personally notify those tested of their results. Other ongoing missions include a warehousing mission in which we have approximately 20 citizen soldiers assisting DHS at a state warehouse where they are receiving PPE shipments, repackaging them, and redistributing them to areas in need. Another warehouse team reported last week to the alternate care facility at State Fair Park to assist with warehouse operations where they'll bring that facility online. Approximately 50 additional citizen soldiers are on site at the alternate care facility to serve as temporary nursing assistants. Another 50 are standing by and available to support the facility if needed as well. The Guard represents just a fraction of the larger effort to resource the alternate care facility and staff services. Additionally, we are supporting state-run voluntary self-isolation centers in Madison and Milwaukee, as well as another Milwaukee County-run facility with medical monitoring and administrative personnel. Another team of Guard members are also supporting the Dane County Coroner and assisting with mortuary affairs operations. We have additional troops standing ready to assist the state in any way and are currently trained and postured to provide medical surge capacity and assist with logistics support as needed. We continue to work hand in hand with our partners across the state and at the local level in support of Governor Evers' COVID-19 response. To recap other completed Wisconsin National Guard missions, we mobilized more than 2,400 citizen soldiers and airmen to serve as poll workers during the April 7th election, where they performed the same roles as traditional poll workers in their own home counties. We had troops in 71 of Wisconsin's 72 counties on Election Day, with Florence County as the only exception. That was no small feat, as we mobilized all of those troops and had them trained and reporting to election officials in less than 72 hours. Our troops also supported the Wisconsin Elections Commission by procuring wipes, spray bottles, hand sanitizer, and PPE and distributing those items to polling sites across Wisconsin to assist Wisconsin Elections Commission with holding the election in the safest possible manner. In March, we sent a team of 6 medics to a senior living facility in Grafton to augment the staff there for 3 days after a COVID-19 outbreak, which resulted in a temporary staffing shortage. And of course, early in the pandemic, our troops assisted DHS with transporting a group of Wisconsinites who were returning to the state from a cruise ship that had confirmed COVID-19 cases. Amidst the COVID-19 response, we still have more than 700 mobilized troops fulfilling our federal mission, the majority of whom are serving in Afghanistan, Ukraine, and across the Middle East. I want to reiterate how proud I am of every single one of our citizen soldiers and airmen who have been a part of that response and this response to COVID-19. They have truly answered the call in our state's time of need, and we continue to stand ready to support our fellow citizens in any way we can. These service members are your neighbors who work and live in the same communities as their fellow Wisconsinites, and they are stepping up when their state needs them. Serving in this capacity is one of our core missions in the National Guard, and we are honored to be a small part of this all of Wisconsin effort to fight COVID-19. The effort has been equally admirable in our State Emergency Operations Center, where Wisconsin Emergency Management, or WEM, is facilitating the response from every one of our state agencies. Under WEM Administrator Dr. Darrell Willems, the men and women of WEM have also answered the call of our state and gone above and beyond every day in managing our state's response. They are working with state agencies, county emergency managers, public health officials, and other stakeholders to respond in force to this pandemic. Such efforts include the collection and distribution of PPE to medical personnel, law enforcement, firefighters, and other critical professions at risk of being exposed to COVID-19 through essential work and saving lives. Using focused groups working out of the State Emergency Operations Center, WEM is also helping coordinate expanded access to testing materials, building laboratory capacity, and building the capacity to conduct contact tracing across the state. With that, I'd like to thank you for the opportunity to provide an update on the efforts of the Wisconsin Emergency Management Center and the Wisconsin National Guard as we continue to support the state's response to the COVID-19 pandemic.
We will now hear remarks from DHS Deputy Secretary Julie Willems Van Dijk.
Well, thank you, General Knapp. It's been an honor to serve beside you during this response. I came to my role as Deputy Secretary with years of public health experience, including over 21 years at Marathon County Health Department in Wausau. During that time, we prepared pandemic influenza plans and exercised them on a regular basis. And every time I left one of those exercises, I hoped I would never have to actually live through a pandemic response. But here we are. I am grateful for that training and grateful knowing that our committed public health professionals throughout the state are at the front lines of this pandemic response. So what is the SEOC? Let me dig into that a little further for you. The State Emergency Operations Center is where we are bringing together the best and brightest of Wisconsin to rise to the challenges of COVID-19. The SEOC brings people from across state agencies together to attack this issue. In the SEOC, you will find people from a variety of state agencies working alongside people from voluntary organizations, such as the United Way and the Salvation Army, who are working alongside staff from Wisconsin Emergency Management and the Wisconsin National Guard, as General Knapp has said. We have also engaged with partners from the private sector, including Epic and healthcare systems. All of us bring different expertise to the table, and none of us could attempt to solve the challenges of COVID-19 alone. But together, we are one team making great progress. While the people of Wisconsin have pulled together to flatten the curve by staying safer at home, our team has all pulled together to make sure that the number of people who need hospital beds stays lower than the number of beds available. So one approach to that dilemma is to increase healthcare capacity. We have worked on increasing surge capacity by supporting the alternate care facility in Milwaukee. We have also tackled shortages of personal protective equipment, or PPE, to protect the health of our healthcare and public safety workforce. We have worked on finding childcare for healthcare and other essential workers. A second approach is how we prevent the spread of the disease. We have done this by increasing laboratory capacity so we can test more people and know who is infected. We have increased the number of contact tracers so that we can let people know when they need to isolate and let their contacts know when they need to quarantine. We've set up isolation facilities where people can safely isolate if they can't do so at home. And we've set up systems to track the disease and measure how well we are doing. And now this is the work we have to do. We have to supercharge as part of the Badger Bounce Back plan in order to move Wisconsin towards a new normal. This work is all interconnected. Tests don't make a difference unless we have contact tracers to follow up on the results. We can't test more people without PPE to protect our healthcare workers who are doing the tests. So let me share a few success stories about the work of the SCOC and the way we're working together. Early in the pandemic, when the only labs conducting testing were in Madison and Milwaukee, the State Patrol assisted clinics throughout the state by picking up specimens and delivering them to the labs, making the turnaround time on those tests much quicker. When we had a difficult time finding a security company for our isolation facilities, the DNR stood up with wardens who stepped up to serve in that capacity. When outbreaks have hit long-term care facilities, as the one that General Knapp described, local health departments have worked with the staff at those facilities, and when local resources were exhausted, have reached out to the SCOC. We have provided consultation, PPE, and in some cases, working alongside our partners from the Wisconsin National Guard, have provided COVID-19 testing and care assistance, as the General described. These are just a few examples of the ways we are working together to respond to this pandemic. The SCOC is doing the work Wisconsin needs to do to bounce back, to turn the dial on safer at home. We are doing this work for you, and we are doing this work with you. So thank you to the committed people in the SCOC and to all of you who are staying safer at home.
At this time, we will open the line to questions. Reporters will be called on in the order in which their RSVP was received. In the interest of time, we will be taking one question per outlet. All lines are currently in listen-only mode. Once called on, reporters should dial *6 to unmute their lines. Once you have asked your question, we please ask that you remute your line using *6 again. We will begin with Scott Bauer of the Associated Press.
Hi, thanks for doing this call. General, will the Guard be involved in any way with the Friday protest outside the state capitol?
Well, Scott, the Guard has not been asked or tasked to participate in the response to the planned demonstrations on Friday.
We'll go next to Mason Dowling with WAOW-TV.
Hi, can you hear me?
Yes, we can.
Perfect. Thank you very much for taking this call. General, my question is just in regards to the number of National Guard troops that you've mentioned. Over 200,000. It seems like a lot for the comparatively few different places that they're going to. I guess, what is the current, I guess if you want to call it dispersion, where is the number of troops, citizen soldiers being deployed have to do with what they're doing?
Sorry, I might not have said it clearly. It's just over 1,000 right now that we have in direct support of COVID. It's 1,000.
Okay. then I guess what is, if I can clarify then from that, what is the active and ongoing presence? Is it mostly still focused on Milwaukee and Madison, or will it be expanding into central Wisconsin as well?
Well, most of our efforts right now have been, while it may appear that they've been mostly on Madison, Milwaukee, we're prepared to respond all over the state. Right now, one of the big things that we're ramping up is the testing capability with those mobile teams. And those teams are prepared to respond anywhere in the state, wherever we're needed.
Thank you, Mason. We'll next go to Brian Karen with WLUK. As a reminder, star 6 to unmute.
This is Mark Leland from WLUK. I'm wondering, for both of you, I'm wondering just how many National Guard members, while you've been assisting in so many different ways with the fighting COVID-19 around the state, how many National Guard members have contracted COVID themselves? And then specifically for both of you, regarding the election, how many cases from the polls have we seen to date that you can document people contracting COVID?
Okay, I'll start off on that one. In terms of the National Guard, we have had positive cases of COVID across the National Guard. Because of the sensitive medical nature, I'm not at liberty to talk about the specifics. But when it comes to the elections, I can tell you that we have, out of the over 2,400 people that we had working at the polling places on Election Day, we have had 5 National Guard members report symptoms of COVID since working at the polling places. And of those 5, 1 was tested, and their test result did come back negative. And then maybe Julie has some other details.
Sure, and I can add to that. We follow up with every COVID positive patient in the state, either a local health department case contact tracer does, or a state contact tracer. And we have been asking people if they had exposure at the election. As I last spoke with our staff last evening, there are 15 people who tested positive for COVID who also voted or worked as a poll worker. However, we are not able to say that their exposure was necessarily at the polls because they are all people who could have had exposure in other places. And so we have correlation. They voted and they were at the polls, but we do not have causation. We can't say it was because of voting that is why they now have COVID. Because we don't have a comparison group, in order to make that kind of determination, we'd have to have a comparison group of where all the people who have tested negative, whether they voted or not too. So I hope that answers your question.
Thank you. We'll next go to Abigail Handke from NBC 26.
Hi, I was wondering just of the National Guard in Wisconsin, how many members there are and what percentage has been activated, and if you believe like a full 100% of people who are in the National Guard will be called to service.
Hi, Abigail. Thanks for that question. In total, the National Guard, we have just under 10,000 total members. Right now, we have over 700 of those are deployed in mostly overseas locations in support of our federal mission. Right now, we have just over 1,000 Guard members that are actually directly supporting the COVID response. I'm not good at math in public, but it's approximately 10%.
Thank you, Abigail. We'll next go to Emily Fannin with WKOW-TV. As a reminder, star 6 to unmute your line.
General Knapp, you said, you have a lot of missions going on, but are you worried at all about running out of PPE equipment for your Guardsmen and women during this time?
In terms of PPE, we all are always concerned about running out of PPE. It's one of the most valuable resources that we have right now, in particular N95 masks. But I'm glad you asked that question, because what we're doing in terms of the Guard response and using the National Guard test teams, there is a specialized equipment that the National Guard is trained on, the P2000, the M45 and M50 masks that we have in our stockpile to use for a number of missions that Guard members are already trained on. We're able to use those in responding to the COVID pandemic in place of the N95 masks, and then we're able to preserve those N95 masks for the frontline healthcare workers.
Thank you. We'll next go to Ben Wagner with WISN TV.
Hi, everybody. Thanks for doing this call. My question is for Julie Willems Van Dijk. It's about these alternate care sites. Given our hospital numbers now, do you think that these alternate care sites in Milwaukee and Madison will be necessary, and what's the status of recruiting volunteers to staff them? Thank you.
Sure. Let me clarify. The only alternate care site that is actually up and almost ready to open is the one in Milwaukee. The Madison site is still in a planning stage. We built the site because of the modeling that we saw, and we wanted to be prepared. The last thing in the world we want is citizens in our state to not be able to get adequate care. And so the models we looked at suggested that there was a high likelihood we could exceed our hospital bed capacity, particularly in the Milwaukee area because of the number of cases. And we stand ready to provide that care if it's necessary. Now, each hospital has a series of ways that they can surge, and so they will use that surge capacity, and when they've gone beyond that, they'll come to the alternate care facility. We're doing a great job on the volunteers. I'm not going to give you a number because I don't remember the exact number of how many people have volunteered through Weaver, the Wisconsin Volunteer Recruitment Network, but it's in the hundreds, if not thousands, and we have secured most of the clinical staff for the alternate care facility through that mechanism, coupled with, as what General Knapp reported, some great assistance from the Wisconsin National Guard. So the alternate care facility is near ready to accept patients if we reach that surge capacity in our state.
Thank you. We'll next go to Carolyn Peterson with NBC 15. As a reminder, *6 to unmute your line.
Can you guys hear me?
Yes.
I apologize. Thanks for taking our questions. Do you guys know the status? I know that you said it was still in the planning stages, but of the Alliant Energy possible alternative care facility. Last time I checked with county officials, the application with FEMA was still pending.
They are still under discussion about that facility.
Thank you. We'll next go to Rob Sussman with WTAQ.
Rob, we have right now probably the highest rate of growth outside of Milwaukee here in the Brown County and Northeast Wisconsin area. Can you kind of just talk about specific operations of the National Guard in the Brown County area, especially around the places where it's spiking, like these meatpacking plants in the area?
Yes, Rob, we right now have not been received any requests for assistance to assist in the Brown County area. However, we are prepared and ready to respond when those requests for assistance come in whatever manner that we can help best.
Thank you. We'll next go to Rachel Glosh with TMJ4.
I'd like to ask about nursing homes. We've noticed the DHS is including nursing home related data now on their website. Why is that important to publish? And how should those facilities be handling COVID cases and sharing information with families and the public?
Great question. We are publishing that information because we are working to be transparent and help people across the state understand where the disease is affecting people. We know that this disease is particularly virulent for the oldest members of our society. And so since long-term care facilities are primarily homes to our senior members of our community, they are a particular place where risk of infection is high. We are really proud of the way our long-term care facilities across the state have responded to guidance from DHS and from the CMS, the Federal Medicaid Services Department, who have encouraged them to do a number of activities that help protect residents in their facilities. It's things like not allowing visitors, making sure they're screening their staff, upping their infection control procedures, and when they do have a COVID positive resident, how they are using PPE, isolating that resident, isolating other residents who may have been in contact. And so these are all important infection control measures, and we here at the SEOC are working very closely with long-term care facilities when they have a resident or a staff member who tests positive for COVID-19 to be their consultants and assist them with taking those actions.
Thank you. We'll next go to Sean Kirby with Wisconsin Health News.
Hi. Thank you for doing this. Could you talk a little bit about how well utilized the state's isolation facilities have been in Madison and Milwaukee? Like, what number of patients have they served? Thank you.
We'll have to get you that number of patients after the call, Sean. I don't have the current number or the total number right at my fingertips.
Sean, we will follow up post-call. We'll next go to Chuck Odzma with WKBT.
Good afternoon. Good afternoon. I have a couple questions for General Knapp. You said some Guard members have tested positive. Can you talk a little bit more about that? Is it making it difficult to recruit or assign more members to missions? And are they having additional protections when they are assigned?
Chuck, to answer your question directly, the positive COVID-19 cases that we've had across the National Guard have been very low. In fact, we've had, of the handful that we have had, the majority of them were not Guard members that were actually serving in response to COVID-19. Those are Guard members that had not been called up and were serving, and were basically working at their civilian job or at their homes out in the community. Regardless of whether the Guard member is actively participating in the response to COVID, or if they're out there doing their civilian job or not activated, our follow-up is the same. Their primary first line of defense or line of protection is with their primary health provider. Guard members are state employees when they're on state active duty. And so they follow up with their primary care provider just like everyone else does out there. But then being a member of the Wisconsin National Guard is like having another family. And so in our family, we also take great care of those Guard members by routinely checking up on them. And we have a protocol where we make sure and reach out to them, let them know about isolation and quarantine, and then routinely follow up to make sure that they are receiving the appropriate care.
Thank you. We'll next go to Pat Poblete with WisPolitics. As a reminder, *6 to unmute your line.
Andrew, while we're waiting, I can go back. The second part of his question was on recruiting. And that was a great second or a follow-up question. And I would like to address that because recruiting in times like this, in times of pandemic and much like after 9/11, actually recruiting, we tend to see a surge in recruiting after events like this because of events where I can get out with the media and talk about what the National Guard is doing to help right here in our own communities as citizen soldiers. It's very appealing to a number of Wisconsinites to participate and to help their neighbors. And therefore, we're actually anticipating an increase in our ability to recruit going forward.
Thank you, General. We'll next go to Charlie Pittman with WORT.
Hello, this is Jonah Chester filling in for Charlie Pittman. General, you mentioned that one of the mobile specimen collection teams had been deployed to a Milwaukee corrections facility. What other plans does the Guard have to help the state in administering COVID-19 testing and safety measures in its correctional facilities?
That's a great question. We did go to the House of Corrections in Milwaukee County, and that's an example of how we use our mobile teams in a rapid response. We're capable of doing that, a similar or another response like that across the correction facilities throughout the state. And we would look for a request from the Department of Corrections if it were a state facility, or from the local emergency manager if it was a county facility. And then we can come in and help offer that testing ability if they were to have something like an outbreak in a prison or a jail.
Next, we'll go to Meg Jones with the Milwaukee Journal-Sentinel.
Hello, General. My question is in regards to the 700 Wisconsin National Guard troops that are serving overseas in Afghanistan, Ukraine, and other places. Now, I know that they're on a federal mission right now, but the question that I have about those folks is, do you know if any of those 700 Wisconsin National Guard troops serving overseas have tested positive coronavirus? Do they have access to coronavirus testing in those countries? And will any of those units, is there any discussion to bring those units back to Wisconsin earlier than expected because of the pandemic?
Yes. The first part, in terms of medical care and testing ability, they are, through the federal government, available to get both medical care and testing if they were to experience the symptoms of COVID-19. In fact, I can't go into the specific operational details of their assignments, but they are following very similar guidance in their deployed locations that we're following here in the United States to protect against COVID-19. In terms of coming home early or departing later, right now the Department of Defense has instituted a stop movement order, which is primarily going to affect those units that are scheduled to deploy from the United States to go overseas. And then that also may affect some of the Wisconsin Guard members in terms of the timing of when they'll come back to the United States. I'm not able to talk about specific dates as it relates to deployments for operational considerations. But right now, the impact overall to the health and safety of the members seems minimal in that we're taking great care of them, whether they're here or overseas.
Next, we'll go to Dan Malloy with Spectrum News 1.
Hi, thank you both for doing this phone call with us today. With the bounce back Wisconsin guidelines regarding testing and contact tracing, I'm curious if the National Guard is preparing to utilize more citizen soldiers than the 10% right now, if there's any connection with the bounce back plan and more citizen soldiers getting involved in the response.
Great, and thanks for asking that question. The simple answer is yes. We're prepared to bring on more citizen soldiers and airmen in response to COVID-19, in particular to support the Badger Bounce Back Plan. Right now, as I mentioned, we're bringing on just this week 8 more teams, approximately 225 more individuals to assist directly in the testing effort. But we have other plans right now in the works to bring on additional members to do things like add additional teams if that were required past the original 11 that we're talking about. We also then, I think I mentioned it in my statement, that we have people working in the call center as well. And then if DHS requested, we also would be able to help them in other areas across the state to include contact tracing assistance. Right now, there's a great plan in the works to get that contact tracing stood up, and we haven't received a specific request yet in that realm. But we're definitely ready and able to mobilize a significant additional number of guardsmen.
Next, we'll go to Addie Bink with WFRV.
Hi, thank you. My question has already been answered.
We'll go back to Pat Poblete with WisPolitics, who had technical difficulties. Pat, are you there? *6 to unmute. Pat, we cannot hear you.
Hi, can you hear me now?
Yes.
Gotcha.
Sorry about that. So, General Knapp, you said earlier that of the 5 guardsmen that had experienced symptoms of COVID-19 after serving as poll workers, 1 had been tested and that test came back negative. Have the other 4 members been tested?
No, they have not been tested. They all went to their primary care physicians and expressed, or they called in or reported to their primary care physicians and reported their symptoms, and they were not offered a COVID-19 test. So that kind of is a good segue into us asking in terms of Badger Bounce Back, to asking to help get out the new guidelines, or the guidelines that everyone who has COVID symptoms, we're hoping that they can get a test. And the first line of defense, or the first line of avenue in order to get that, is for people to get that test ordered by their primary care physician.
Thank you. We'll now go to Chris Hubich with the Wisconsin State Journal.
Hi, thanks for taking my call. With new cases sort of plateauing, the focus on reopening the state, I'm wondering if you could talk about the plans to keep some of these measures like isolation centers, alternate care facilities in place, and for how long, with the potential of new outbreaks or recurrence?
Well, Chris, that's a great question, and I'm glad you mentioned the possibility of new outbreaks. One of the things we know about pandemics is that they generally don't come with one peak. They come with multiple peaks. In fact, if you look back at the data about the Spanish influenza pandemic, it wasn't the first peak that killed the most people. It was the second peak of resurgence in the fall. And so a couple of things I would say about isolation facilities and the alternate care facility. First of all, isolation facilities were stood up by the state, and we are in the process of checking with our local partners if they'd like to take over operation of those. We did it quickly because we knew we were in an urgent situation, but responsibility for these kinds of operations is really best led by our local partners who know the needs of their community the best. And so we're in that process in Madison and Milwaukee, and we're also talking with people across the state as they think about moving forward, especially as we start to open our state and test and ask people to isolate, to be sure there are places in their community that people can isolate. That doesn't mean everybody needs an isolation facility. Some of those might be accomplished through renting rooms in hotels or other facilities in their community. And each community will figure that out the best. And similarly with the alternate care facility, we want to keep it open as long as we can until we see where this pandemic is heading. We'd hate to close it down too early and then have a resurgence and not have that resource available to us. So I know it can be frustrating, but one of the things about this response is there is a lot of watch and see. Open the door a little, see how the virus responds in our community. If things are calm, open the door a little bit more, open up our businesses and services a little bit more, see what happens. And if cases rise, dial it back a little. And during that whole time, we need to keep a strong response in case we hit a surge, ready and able to deploy again.
We'll next go to Chuck Kornbach with Milwaukee Public Radio. As a reminder, *6 to unmute your line. We'll move on to Adam Brewster with CBS News. Adam?
Hey, my question is for Julie. First, just a point of clarification. Your office had put out a statement earlier that said there were 19 people who had voted or worked. You mentioned 15. I was just hoping you could clarify the potential discrepancy there. And then when you think we might start to learn more, or when we might be past the window of learning how many people may or may not have been infected by voting on April 7th.
If my office put out a statement of 19, that would be the more recent data. The 15 was based on a conversation I had last evening, so I'd use the data from our department that was issued. In terms of when that window closes, here's what we know about the disease. Symptoms can appear for up to 14 days after exposure, but usually within 3 to 5 days. So we're reaching the end of that 14-day period when we are likely to see cases of positive illness that also might have been people who voted in person or worked at the polls. There can be a little bit of delay beyond that because of the time frames for testing, getting test results back, and reporting to us. But we would generally expect anyone who would have had an exposure on April 7th to have exhibited symptoms by April 21st, which was yesterday. And so I would anticipate, that over the next week we would be clearing out any reports of positive cases that also reported voting or working as a poll worker.
Next, we'll go to Isaiah Holmes with Wisconsin Examiner.
Hello, can you hear me?
Yes, we can.
Alrighty, thank you for taking my question, and thank you for your service to the state. Thank you. My question is for the general. Have there been any discussions or plans in regards to using National Guard troops to supplement correctional officer staff in correctional facilities in the state if their staff, if too many of them get too sick? That's it.
Yes. The short answer is yes. We've had discussions about that. It is actually a long-standing, decades-long mission of the Wisconsin National Guard to augment the Department of Corrections in case of a staffing crisis, which would be similar to something that we would occur during a pandemic. So it's a long-standing plan that we've had in effect to assist Department of Corrections. We have been monitoring Department of Corrections facilities very closely. We're in close contact with the Department of Corrections. There's actually in the state EOC, there is a liaison officer from the Department of Corrections that we talk to every day to get the latest status on their staffing.
We'll next go to Adam Duxter with CBS Channel 3. Adam, *6 to unmute your line. Moving on, we will go to Casey Cronus with Fox 6 Milwaukee.
Hi, this question is for the Deputy Secretary. If you could just tell us a little bit more about the efforts to contact trace cases stemming specifically from Election Day. I guess I'm just wondering, is there even a way to get in contact with all of the people who were near a COVID-19 positive person on Election Day, whether they were in line with them or contacted them if they were a poll worker? Is there even a way to contact everyone who came into contact with that person?
Well, let me begin that question, Casey, with telling you a little bit about what contact tracing does. So when we say we're doing contact tracing, when someone who tests positive for COVID-19 is identified and reported through a surveillance system called the Wisconsin Electronic Disease Surveillance System to a local health department or to the state health department, we call that person who tests positive. We ask them a whole bunch of questions about when their symptoms started, if they'd been in contact with anyone they knew had COVID-19, if they'd been in other situations that may have exposed them to others with COVID-19, and then, of course, review their health and their symptoms and give them counsel about the need to quarantine for 14 days. And then we ask them about other people they were in contact with. And so, and then we reach out to those folks. So in the case of someone who would have voted and tested positive for COVID-19, that's how we would identify people. There has been no effort to try to find everybody who voted or even reach out to every poll worker, because while there certainly is risk being out in the public today, we know that people who went to the polls and our poll workers were using PPE and doing many things to prevent transmission. And so we contact people who they've been in close contact with, and unless someone would report to us some unusual circumstance associated with the election, I mean, for example, a poll worker who had spent the whole day with other poll workers, we would certainly notify them. But someone standing in line, and especially standing in line, social distance, 6 feet apart, is a lower risk for exposure to others who they may have encountered at the polls. So that's how we would follow up. If there were close contacts, like people, like poll workers who had spent the whole day too, they would certainly be notified. Casual encounters would not be.
Thank you. We'll next go to Brendan Cullerton with CBS 58. As a reminder, *6 to unmute. Moving on, we'll go to Shaquille Brewster with NBC News.
This is Carol Eggers, just filling in for Shaq. I had a question. In Chicago, when poll workers were identified with a positive test, the Board of Elections let people know which polling places they had served at. Will you be doing that?
Again, if we have poll workers who would test positive, we would certainly identify that, and we would certainly, when positive cases are identified, we will let the municipal or county clerk know that there was someone who voted at their site or a poll worker at their site. That notification would be made.
Thank you. Next we'll go to Jeremy Janine with Urban Milwaukee.
We heard General Knapp lay out a scenario that 4 individuals with symptoms didn't get tested, which seems to go against DHS guidance, and he touched on that. DHS continues to report that the state has substantially greater capacity to test people than are actually getting tested, but it seems like there's a gap with physicians in ordering tests. Why is that?
That's a great question, and it's one we're working with our healthcare partners on right now. I think what's important to remember about this pandemic is it is constantly changing. And so in the early days of the pandemic, we told physicians not to test unless people were seriously ill or had been in contact with someone known to have COVID-19 or were healthcare workers. And we gave them that counsel early in the pandemic because we didn't have enough tests. We're now in the period where we're shifting that. We have, as a state, done a great job thanks to partnerships with many of our healthcare systems and with companies like Exact Science that are bringing new tests on board. And so we now have a very different situation. So we're trying to get the word out to our physician and healthcare partners that the scenario has changed and that we do need them to test people with mild symptoms. But there are other barriers as well, too. You can't test unless you have PPE. And as we've been talking about, PPE is in scarce supply. And that's one of the reasons we're so appreciative of the Wisconsin National Guard teams to be able to supplement our efforts here with their reusable PPE. You also have, this is a very different mindset for many physicians, because if you think about the flu, influenza in the fall, if you call your doctor and you're a healthy younger person with symptoms of the flu and you don't work in a healthcare setting, they're probably going to tell you, stay home, don't go to work, don't expose other people, drink fluids, take Tylenol, and call me back if things get a lot worse. And so this is a very common medical approach to something like COVID-19. And it is prudent. You don't want to bring people who are infectious into the clinic. What's different here, and what we are helping our healthcare providers understand, is we need them to test people because of our public health response. Because in this virus that can be transmitted to other people who may not easily tolerate it, we need to know everyone who has the virus so that we can take the steps we've been talking about to make sure that people who are infected and mildly ill are quarantined and stay home until their symptoms pass, and that we can contact their close contacts to stay home as well. So it's a real mind shift for our physicians, and we appreciate everything they're doing to address this disease. And I think we'll start to see a shift where those 4 citizen soldiers, if they called today, would get a test, whereas a few weeks ago they didn't.
Thank you. Our final question will come from Miranda Suarez with Wisconsin Public Radio. Miranda?
Hi there. I just wanted to ask in regards to the tests performed at the Milwaukee County Jail. Do you have results on those tests yet? How many positives, how many negatives?
We do not.
Okay, thank you.
That concludes today's question and answer period. We'd like to thank you for joining us. As a reminder, this broadcast will be available on the Department of Health Services YouTube channel. Also, you can find the state's latest information on the response to COVID-19 on the Department of Health Services website at dhs.wi.gov. We'd like to thank Major General Knapp and Deputy Secretary Julie Willems Van Dijk for joining us today. Thank you for your time.
This program is a production of WisconsinEye, an independent, nonpartisan, nonprofit media network with a mission to inform, educate, and engage the citizens of Wisconsin. WisconsinEye is the nation's first and only independently funded state civics broadcast network, providing gavel-to-gavel access to government proceedings and events at the state capitol.
Hi, I'm John Henkes, President of WisconsinEye Public Affairs Network, and I'm speaking to you today to ask for your financial support. For 14 years, WisconsinEye has provided uninterrupted, gavel-to-gavel live coverage from our state capitol, the legislature, the Supreme Court, the governor's office. We're proud to continue to do that and continue through this time of crisis with important coverage. We are 100% committed to bringing these important meetings into your home or place of work. We've created online pathways that allow us to connect you live with these important events. But WisconsinEye needs your help to do so. At this time, we are facing unprecedented staffing, technical, and financial challenge. So if you rely on our coverage to stay informed on issues you care and need to know about, I ask that you consider a one-time charitable gift today to help us through this challenge. Whether you're following the DHS briefings, the Wisconsin Elections Commission, or leadership briefings from the state capitol, or any of the timely interviews conducted by our senior producer, Steve Walters, we could use your support today. If just a fraction of the thousands who value WisconsinEye coverage say yes with a gift of any size, it will provide a huge boost. So thank you. To donate, please text WisEye to 44321. That's WISEYE to 44321, or visit wiseye.org/donate. WISEYE.org/donate. Or you could send a check to 122 West Washington Avenue, Suite 200, Madison, Wisconsin, 53703. Again, thank you so much. Please be safe. Stay optimistic. We are Wisconsin.